Hi, so good morning. We're going to be talking about pneumonia today. Broadly defined, pneumonia is any infection of the lung parenchyma. In about 50% of the cases, the pathogen is unidentified that caused it, and so we've taken to defining pneumonia by the clinical setting that it's acquired in rather than what kind it is. So you've got community acquired pneumonia, which is any kind that you get out in the world. There's hospital acquired pneumonia, healthcare associated pneumonia, aspiration, and then chronic pneumonia, which is typically found in people who have tuberculosis. Um, Today we're going to be talking about bacterial pneumonia specifically, just to focus in on one kind and how to treat it. Uh, the signs and symptoms of pneumonia would be, you know, increasing weakness with exertion, especially a cough that tends to become productive over time if left untreated. It can have yellow, green, brown mucus. When it turns to blood, then you know you've got a problem. Pneumonia can come along with fever and other signs of just normal infection like weakness, headache, and things like that. For comorbidities that come along with or precipitate pneumonia, you've got people who have chronic lung infections, lung respiratory issues like COPD, asthma. If you've got congestive heart failure, it's going to cause fluid buildup on the lungs, which can lead to pneumonia. Smokers, of course, cause insult to their lungs all the time, and so they are more prone to develop pneumonia. And people with weakened immune systems. So the pathophysiology of the pneumonia disease process is that this occurs when your pulmonary defenses are compromised in any way. So you've got nasal, tracheal, and alveolar mechanisms that filter, neutralize, and then clear foreign objects and bacteria that lead to bacterial pneumonia. And when they're not able to do their work for whatever reason, the bacteria build up and then cause the infection. This can be due to decreased cough response or ability to cough. People on a ventilator have this issue. Injury to the lungs, whether that's mechanical or chemical, as in smokers. You've got a problem with secretion exchange, can lead to this. And then, of course, the fluid buildup from CHF. So your alveoli, when they become infected with these different kinds of bacteria, become porous. They fill with fluid and blood instead of the gas that they're supposed to be filled with, as they're exchanging O2 on inspiration with CO2 for expiration. And then consolidation occurs as this infection spreads from alveoli to alveoli, and then it can infect an entire lobe or even a whole lung or both lungs. You wind up with a reduction in the surface area for appropriate gas exchange and decreased ventilation perfusion ratio, which can lead to hypoxemia and hypercapnia. And then the gold standard for the diagnosis of pneumonia is, of course, a chest x-ray, but you can also check blood for white blood cells, maybe a blood gas for your O2 and CO2 levels, although you can get those from a good blood sample as well. So treatment options for bacterial pneumonia especially are going to be antibiotics, of course, to go along with fluids, rest. Normally you have to base the antibiotics on blood cultures to make sure that you're delivering the right kind of treatment. And then breathing treatment can help, and as well as the vaccine, the pneumonia vaccine, can help with some of the bacteria that cause it. So some of those bacteria are most commonly Streptococcus. There's also Haemophilus influenza, staph, of course, Klebsiella pneumonia, and Pseudomonas aeruginosa are some of the more common known agents. The way that antibiotics work on these is that they target the cell functions that are specific to those bacterial cells, although they do affect normal cells as well. Some of the things that antibiotics can do is block cell wall construction, prevent protein building, and then interfere with the DNA process of the bacterial cells. They're very effective given time. Sometimes you need IV antibiotics as opposed to PO, but usually if the antibiotic is right for the bacteria that's plaguing you, you can get over this in a few days, and then you just need to allow your body the time for its normal defenses to recover. So, of course, if you go straight back to smoking after getting over pneumonia, you might just keep on going with pneumonia. As far as genetics, environment, and lifestyle go, and pneumonia, of Of course, as we've said, smokers are going to have this problem. People who are sedentary and inactive and don't give their lungs the work that they need. People who are on a ventilator, chronic disease processes, again, people with weakened immune systems. Things that you can do in order to prevent getting pneumonia would be just practicing good hygiene, cough etiquette. Of course, don't smoke, and keep your immune system strong. So everything we say about healthy living applies here. You need to get good sleep, you need to exercise, have a good diet, and hopefully you can prevent yourself from getting pneumonia in the future. So, thanks for listening.